when it comes to replacing testosterone, it's also advised to use the transdermal route or skin. So we're going to use either like a cream. They don't really have patches. They do have the subcutaneous injections, which is less preferable to the transdermal. But definitely, we do not do any oral testosterone, as it does have a lot of adverse side effects and adverse effects on the body. So that is kind of in a nutshell. We try to do transdermal for testosterone. So let's kind of look at a brief little overview again of hormone replacement therapy in general, especially postmenopausally. It has been shown with hormone replacement, the effects of hormones on the brain chemicals are just amazing. Production of serotonin, GABA, dopamine, norepinephrine. These are all, parts of our brain that will actually be healthier and stronger when we are having ideal and optimal levels of hormones, estrogen, progesterone, testosterone. In the brain, as far as the brain goes, when it comes to hormone replacement, that they actually found in one study that women who used hormone replacement therapy for more than a decade were actually less likely to develop dementia or Alzheimer's later. Again, it shows how important these hormones are to our brain. And then if you find another study actually shows that if we use estrogen treatment for 2 to 3 years around the time of menopause, again, you have a reduction of cognitive impairments 5 to 15 years later by 64%. So a lot of benefits to using a hormone replacement around the time of menopause.